Tonight on KGW News.
The next couple of weeks are going to be really tough, and it is important for people to understand that.
Health leaders address the layers of problems keeping hospital beds full across the state. Plus, industries are offering huge signing bonuses to fill a worker shortage. But will they work in the long run?
It serves a purpose, but I have my hesitations about them.
And a Portland man learns strangers are staying in his apartment while he's out of town.
I don't know, it was like my brain flatlined.
Then he comes back to find his home like this. Your news starts now. It has now been exactly 2 years since the first case of coronavirus was found in the U.S. January 20th, 2020, a man walked into a hospital in Everett, Washington with flu-like symptoms. The next day, he became the country's first confirmed case of COVID-19. 68 million cases later in this country, the virus has now claimed the lives of nearly 860,000 Americans. Despite the sobering toll of the pandemic, after 2 years, it's clear the restrictions we've been under have also taken a toll. Frustration spilled over today during a hearing on Oregon's indoor mask mandate. The state wants to change the temporary rule to keep it in place indefinitely. Tonight on The Story, Maggie Vespa took a closer look at the concerns.
Under Oregon state law, temporary emergency measures like this can only last 180 days. So the OHA either has to drop the indoor mask mandate when it expires next month or make it, what they're saying, is permanent. A spokesperson telling us, quote, that does not mean the rules will be in place permanently. OHA can rescind or cancel a rule when it believes it's no longer necessary. But that didn't do a lot to calm the long line of people, metaphorically, it was on Zoom, who spoke at OHA's public hearing on Thursday. A lot of them zeroed in on the promise that this won't be permanent, a promise that they point out comes with no timeline or metrics specifying when the mandate would lift.
No longer have any faith in OHA and the mask mandate today. And before you tell me that a permanent mandate can be canceled at any time, I don't care.
The public doesn't trust you to end it when you say you will. Just last year, the public was told that if we reached 70% of the adult population got a COVID vaccine, the restrictions would end. Then just 3 months later, those restrictions and masking was reimposed.
The people simply do not trust you guys anymore. We don't believe that you're going to take into account the best interest of Oregonians, and we don't believe that you're going to repeal this.
Okay, so that meeting went on for hours, and during it, Cynthia sent us an email. She wrote, I sincerely hope that you will importantly report on the fact that there has not been a single speaker in support of this. There are too many of us, she added, to ignore. That brings us to how some against the mandate illustrated their frustration on Thursday. The conservative group Free Oregon staged this mask barbecue in front of the Portland OHA offices. Writing on their invites, the OHA votes to incinerate our rights with a permanent mask mandate. Now, we've asked OHA multiple times for an interview, and right now they are declining. They do point bluntly, though, to the state of the pandemic, and it's illustrated on this graph at KGW.com that shows daily case rates. Look at that peak on the right. Omicron has been shattering new case records, so transmission is higher than ever. And good quality masks like N95s can help stop that. And we also know COVID fatigue is peaking too. The current mask rule expires, as we said, on February 8th. So we'll find out what the OHA decides to do in the next few weeks. I'm Maggie Vespa, KGW News.
In addition to the record high case counts Maggie just showed us, COVID hospitalizations in Oregon continue to rise and are nearing record highs as well. And that has hospitals again sounding the alarm. This chart shows the number of COVID patients statewide who were hospitalized, and the far right side shows today. It's over 1,000. Not as bad as mid-September, but it's getting there. Becky Hultberg is the CEO of the Oregon Association of Hospitals. She said the coming weeks could be bad.
The lack of available hospital beds is pushing the system everywhere to a breaking point. There is good news. The good news is that most patients in the hospital with COVID-19 aren't as sick as they were during the Delta wave. But the sheer number of patients, exacerbated by staffing and discharge challenges, has the potential to overwhelm the healthcare system.
Those discharge challenges she talked about are happening because long-term care facilities don't have openings because they don't have enough staff. So many patients that would be sent to them have to stay in the hospital. The state is bringing in more staff for those care facilities and opening temporary places for people to recover, but Holtberg worries it's not enough. If you want more details about the latest COVID numbers, text the word coronavirus to the number on your screen. 503-226-5088. We'll send you a link to our story on KGW.com. It includes interactive graphs spanning the entire pandemic and info on where you can get a COVID vaccine. New Seasons is now requiring its employees to be vaccinated. They have until mid-March to get a COVID shot or apply for an exemption. Staff who receive exemptions will be required to undergo weekly testing and wear face masks at work. The grocery chain said if a worker tests positive for COVID, they will get supplemental paid time off. New tonight, in several industries, companies are looking to hire, and many will pay top dollar to get candidates to accept a position. From healthcare to transportation to food service, hiring or sign-on bonuses are becoming more and more common. Alma McCarty's live in the newsroom with an expert's take on whether this incentive really works. Alma?
Yeah, I spoke with a professor of management at Portland State University who tells me sign-on bonuses aren't new. But before the pandemic, these incentives were offered mainly to people in high-level positions like CEOs and managers. Now even entry-level jobs might have this perk. Though they serve a purpose, she says she has her hesitations.
We talked about essential workers over the pandemic, and truck drivers are part of that essential group. Truck driving is a tough job.
A tough job now facing a growing driver shortage. The American Trucking Associations estimated late last year that this shortage would hit a historic high. Over 80,000 drivers needed.
Drivers are in demand.
Cheyenne Wright, director of driver recruiting for Tennessee-based U.S. Express, says that means you might come across their online postings. One listing in Portland touts a $30,000 sign-on bonus for a team of 2.
It is legit. So if me and you were in a truck together, I would be driving while you're sleeping, and vice versa. So the truck never stops.
She explains that money is paid out over the course of a year.
So we're trying to make sure that our offerings and those incentives that may catch their eye are in front of them. We've had a great response to our bonus offers.
Eye-catching offers also seem to be driving up applications for TriMet bus drivers. The agency announced a $2,500 signing bonus in November. Since then, officials say they've gotten 240 applications. Looking back a month and a half earlier, TriMet received 136 applications in the same period of time. School bus driver shortages locally, prompting some bonuses or wage boosts as well. Portland State Professor of Management Baron Ardoin explains other sectors feel similar strains and shortages.
In some industries, in some companies, it is harder to find people. Retail, restaurants, hospitality, nurses, and teachers. So those have been the ones that were more visible to me.
To put it bluntly,
I am placing the blame firmly on wages and working conditions. So what I'm seeing is compared to prior to the pandemic, these jobs became much worse. They were never very easy jobs to perform, and they were never the high-paying jobs to begin with.
While she argues hiring bonuses do help in finding new workers, they can also have unintended negative consequences, like a sense of unfairness for existing employees or a culture of turnover. Ardoin's advice: stop employees from leaving the job in the first place with things like retention bonuses, employee referrals, and additional benefits.
So instead of short-term solutions, just investing in employee relationships, I would recommend that.
Ardoin said the signing bonuses themselves are short-term commitments since she believes many companies feel staff shortages aren't permanent. Compared with higher wages, she says it's less costly.
Thank you, Alma. Developing tonight, Portland city workers have voted to authorize a strike. Right now, the District Council of Trade Unions is bargaining with the city. The vote doesn't necessarily mean a strike is imminent, but that the bargaining team can now call for one if negotiations break down. The union rejected Portland's last offer on wages and a cost of living increase. The union represents 1,200 city employees. Now to an update on the I-5 Rose Quarter expansion. The Federal Highway Administration has pulled its approval of the project at least for now. It is asking ODOT for a new environmental assessment. Catherine Cook talked with ODOT and critics of the project about what that means.
Welcome to the freeway fight, ODOT.
Aaron Brown volunteers with a grassroots group called No More Freeways. They've spent months protesting ODOT's I-5 Rose Quarter expansion project, a project that's now on hold. This week, the Federal Highway Administration rescinded its approval for now. They asked ODOT to produce a new environmental assessment to reflect the project's updated designs. They include these highway covers. They'll cap part of I-5, allowing for development over the interstate, including access by foot and bike.
We do believe that today's or this week's announcement is spurred, in fact, by our continued legal persistence and making sure the federal government was aware of what ODOT had been proposing and how the community objected to it.
ODOT does not believe that's the case.
We knew all along in adopting that design concept for further evaluation that we would have to do just that, further evaluation, further environmental review.
Project Director Megan Channel says doing that additional review should not change ODOT's timeline on the project.
But if the environmental assessment does find that there are significant impacts that cannot be avoided through mitigation, then we would work with our federal partners in pursuing an environmental impact statement if needed.
The expansion will add merging lanes on Interstate 5 between 405 and I-84 to improve the flow of traffic.
The need for the Rose Quarter project isn't going away.
Neither, says Brown, is opposition to the project by those in his community group.
I actually work in this neighborhood.
While he applauds the concept of capping I-5, he and others question the broader community impact that expanding the interstate may have. For example, Portland Public Schools is considering moving Harriet Tubman Middle School, which is already close to I-5, citing concerns over noise and air quality.
It's these ripple effects throughout our community because no one has the guts to stand up to ODOT.
ODOT is expecting a new federal decision document in December. They're planning on starting the expansion project late next year, with construction on the highway covers beginning in 2025. Catherine Cook, KGW News.